The way America is running people out of female dominated professions, folks better get their health and wellness together right now, because what is going on in healthcare, what is going on with teaching, people are going to be on YouTube teaching themselves how to do a trach and do CPR. People are going to be on YouTube learning this stuff for themselves, because nurses and doctors are running away from the healthcare profession. So this was an article I just came across. The healthcare staffing crisis is bad and it's getting worse. America is in dire need of more healthcare workers. There are shortages throughout the system, from doctors and nurses in hospital emergency rooms to aides who work in the homes of seniors and people with disabilities. The crisis has been brewing for years as aging baby boomers put unprecedented strain on the healthcare system. The COVID-19 pandemic has only magnified the problem. About 100,000 registered nurses left the workforce in the past 2 years because of stress, burnout, and retirement, and more than 610,000 others plan to leave by 2027 for those reasons. Many nurses felt emotionally drained, used up at the end of the rope, the study found. Almost half of the employees in state and local public health agencies left their jobs from 2017 to 2021. The number of home care workers per 100 Medicaid participants receive health services decreased by 11.6% from 2013 to 2019. And by 2034, the U.S. could see a shortage of as many 124,000 doctors, according to the Association of American Medical Colleges. This is a national emergency that requires urgent attention from multiple stakeholders, including policymakers and hospitals and the public. Y'all need to be aware of this. Staffing problems continue to cut into profits of healthcare providers. Without enough nurses during the pandemic, companies such as HCA Healthcare Inc. and Tenet Healthcare were forced to rely on more expensive contract workers. They are trying to hire more full-time nurses, in part by offering higher pay. They should have been offering higher pay anyway. The structural shortages in the market from a labor perspective haven't just disappeared as we move from 22 to 23, and so contract labor is still an important resource. Inside hospitals, short-staffed emergency departments have been brought to a breaking point. Think about what that means if you're having a heart issue or a car accident. Okay, towards the bottom. The organizations and members of Congress have called on the Biden administration to address boarding when patients languish in emergency department for days, weeks, or months because of staffing shortages in nursing homes or other parts of the hospital where they need to be transferred to receive care. In some cases, patients have died while waiting for 10 hours or more to be seen by a doctor. The pipeline of reinforcements appears to be slowing. Last year, emergency medicine saw its first major decrease in students applying for residency positions. If emergency students and OBGYN students start to decline, think about the health and wellness of the elderly, people that have car accidents, and women overall. This is bad. This is a long article, but I do want to touch bases on this because we are getting older as a country. Home healthcare agencies have long struggled to find workers and to keep them in an industry with 64% of staff turnover in the first year of employment. The job is hard, the pay is low, and the demand is exploding, with the number of Americans aged 85 and older expected to approach 5 million by 2030, according to National Association for Home Care and Hospice. But the pandemic created new challenges. Fear of spreading COVID, many people moved family members from nursing homes to home health care, further straining an understaffed industry. I want to go back to this middle part. The job is hard, the pay is low, and the demand is exploding. So this goes back to where there's typically women in these professions that they are low pay and undervalued. And it's going to bite America in the butt until they start appreciating and paying women. Jump in the comments. Tell me what you think. Like, comment, share.